stem this order. So there's an order for dressing change, and then you're gonna check what type of dressing change. In this case, we're gonna do dressing change wet to dry with irrigation. So alright, so after checking the doctor's order, I'm gonna check my client. Okay, Mr. Osena, my name's Mark from I'm gonna be your nurse, and I'm here to change your dressing. So what we're gonna do, we're gonna replace this old dressing and then put a new one and then clean it as well. Alright, so Mr. Osena, can you tell me your full name? RG Osena? No, okay, that's good. Date of birth? Okay. And do you have any allergy? No? Alright. No, you're not allergic to shellfish or iodine? No? Alright, good. So
Latex.
Latex? You're not allergic to latex? No? That's cool. That's good. Alright, so I'll be back. I'm just gonna gather my equipment and we're gonna start the procedure, okay?
Pain.
Oh, are you feeling pain right now? No? Okay. Alright. But in case the client's feeling pain, we're gonna give pain medication 30 to 60 minutes before we start the procedure. Alright, so I'm gonna gather my equipment. So I need gloves, sterile gloves, 1 Perlex roll, 2 super sponge, 1 abdominal pad, of course your tape.
Show it.
Your tape, alcohol. You need a Q-tip. They call this Q-tips, I believe. The cotton tape Q-tips. And then if you need a suture kit, grab as well, and a measuring
Device.
Make sure you grab a plastic to put your trash, and then grab a water, a sterile water, and then check for the expiration date and check for any sediment. Alright, so this is 2015, so that's good. But if it's okay, and then grab a bulb and syringe for irrigation. Alright, so that's done. So alright, Mr. Osena, so we're gonna start the procedure, okay? So wash my hands, provide privacy. Alright, put my gloves on.
Camera.
Oh, the camera? Yeah, that's the new thing.
The camera is, I'm using the camera.
Yeah.
So.
No,
It's using my
measurement.
Yeah, for measurement.
Take picture.
I'm taking picture right
That
now.
was the new procedure.
Additional.
Alright, Mr. Osena, I'm just gonna use your bed so it won't hurt my back.
And then if risk for spray, we need the gown and the goggles.
Alright, so let me check your wound. Alright, so make sure you just expose the part that needs to be changed. Alright. Oh, okay. Your client. There we go. Alright, so I'm just gonna remove this right here. If it's too sticky, I can use alcohol to loosen it up. And then put your trash as well. And drop my alcohol.
She already placed the chalk under the wound.
Okay, you can do that.
There's one here.
Do you have jack in your equipment too?
Forget to mention you need your jack too. So this will prevent any spill during the irrigation. Doesn't need to be sterile though.
Ouch.
Ouch. Oh, I'm sorry. Did that pain medication did not work? Oh, I didn't give it to you, huh?
No, my
was
leg,
there,
the
right?
hair of my legs.
Oh,
You're
the hair.
peeling, you're pulling him.
That'll be a good
Sorry.
shave.
I'm sorry. Trying my best here. Alright, so once you open the pad, you check for like how's the drainage, if it's copious, a lot, moderate. And then you assess for color. If it's yellow green, that's strap. And if it's blue greenish, that's pseudomonas. Alright, and then what else do you check?
You have to smell.
Odor.
Then if there's any odor,
You have to smell it.
smell,
You put your nose there. Like,
no odor.
no odor.
But if there's a smell, you can really smell it.
Yeah.
It's sweet.
Alright?
You can smell it
Alright.
from afar.
You
So
throw that away.
sweet. Is it sweet wound, really?
Okay, here's the thing. Do we take this off now?
It says
Or I need to be sterile to take this off?
no. You have after you've checked, you've looked, then you have to take your gloves off.
Mm-hmm.
But do I
Have
need
wash
to
your
remove
hand.
this now? The Curlex?
Oh,
Just like
you you had to take it out first before you describe the wound, because you describe the wound first.
Oh yeah.
Mm.
So on the Curlex you're describing the color
Yeah.
of the drainage. Okay. So you remove that. Alright, now you're gonna assess the wound.
Oh, I can see the
If there's
bones.
any maceration. That's ortho. See that? That's
You're
ortho.
gonna describe the
There's a
drainage.
bone.
Yeah, the drainage.
Scan, if it's
I think the
moderate,
drainage is from
copious.
the
dressing.
Curlex roll, from the
Yeah.
dressing. And this you're checking if there's any maceration, scar, and then you check for tunneling and sorry, you grab your Q-tip. Does this need to be done, no?
This is the thing
It's
I'm
different.
Or you need to irrigate first,
Are you
right?
going off of a different book? Because that's different.
I think they have the old one.
Yeah, the old one, they changed it. This is what they want us to go by. Michelle gave us this yesterday.
So what do we need to do
Oh,
next?
Yeah. After you remove that calyx, you check for scant if it's moderate. I mean, for drainage.
Mm.
You describe that, and then you check for the coloration of the drainage. If it's sanguineous, you talk about
Yeah.
that,
get this one. I
and
don't
then
have
you
this.
go on.
This is
and
the
then
new
you
one.
This is-
remove
Copy.
gloves. And then you discard
Is it
your
posted?
gloves.
Yeah.
Is it posted?
And then you wash
No,
your hand
she
with
just
soap
gave it to us.
Oh, Michelle
yesterday.
just gave.
and
Okay.
hot water. And then at this time you check
You wanna look?
normal saline for name, expiration. That's how they
Just
want you to do that.
okay.
Yeah. And sediment, and then you open irrigation tray.
So we irrigate first before
Yeah.
we check the tunneling.
So you're gonna do after you clean the wound. I think they want you to do the measurement.
The measurement.
Yeah, because it's here.
Well,
No, I think
yeah,
that's
that's
after
towards
the
the end.
irrigation.
Yeah,
That's
towards
towards
the end.
Right now.
Yeah.
Here,
When you measure it, you need to be sterile already, right?
Yeah.
Wash my hands.
Let's see. Because now we're here.
Then I already checked this earlier, but I'm gonna check it again just for
Mm-hmm.
name, expiration date,
expiration date, if there's any sediment.
then open.
Open and put it in the irrigation tray.
Alright. Let's put that here. Okay. And pour.
Yeah.
Yeah.
Normal saline.
Alright. So, gonna grab my gloves.
Mm-hmm.
Second gloves.
This is, yeah, non-sterile. That's fine.
Alright.
And then you
So-
grab the irrigation tray
Mhm.
with a
Your
non-dominant
non-dominant.
hand.
So you're right.
Yeah.
Are you left-handed?
Left-handed,
Yeah, I'm
left-handed.
left-handed. So from top to bottom, you're gonna irrigate. Alright, good. So now I'm gonna check for tunneling. Sterile Q-tips. Whoop. So let's say there's tunneling at 6 o'clock. Or should I say that's 3 o'clock?
You're not doing it.
Yeah.
Now. You have to
You're just measuring the outside right now.
the outside of the wound.
Oh, make sure the wound first.
Yeah, before tunneling. Before doing
So you
it.
measure the
Yeah.
outside of the wound?
Yeah.
Like
The size.
the maceration?
Uh-huh.
You after you remove the irrigation supply from the field, you measure the outside of the wound
Mm-hmm.
with
So
the
you use the
measuring
plastic
device.
one.
That plastic, that one.
And then do the tunneling?
Not yet.
And then
You do
take a
the
picture
take a picture
with measuring.
and then take a culture of wound if you need
And
to.
if there's order,
Yeah.
you culture.
Mm-hmm.
And then?
And then
After measure,
remove gloves.
You remove
Then
your
you
gloves
remove your
again.
glove and
Wash
wash
your
your hands
hands.
again.
Oh, so
Now this time
so
it's gonna
checking
be
the tunneling
sterile.
is sterile.
Oh wow! You do like
Alright.
you put on and off so many times.
this is the
Alright,
craziest
so now I'm gonna-
procedure. Wound
Wow.
dressing change.
And then you're gonna set now it's sterile field. You're
Yeah.
gonna set up your sterile field.
So I need to set up my sterile field first.
Mm-hmm.
No,
Or I need to wear my sterile...
No, you.
No, I need to
Set
set up my
your
sterile field
table.
That's
first.
why you have to
Yeah.
Your
remove
table.
that one even before you
Okay.
measure that thing. Okay, now you're gonna do your sterile field.
I'm gonna do my sterile field. So,
On the side of the table, beginning with the super
super sponge.
Super sponge.
So we're gonna start with the super sponge.
So the
And then
super
Carlex.
sponge closest to the
To the
field,
bed.
closest to the bed.
Mm-hmm.
The Carlex.
And then your
In the collar.
legs. Uh-huh.
And then another super sponge.
And then your abdominal. This is a lot of steps.
Mm-hmm.
And then
then
pour
the
normal
abdominal
saline in the collings. No, stop.
You don't put the abdominal pad?
No, not yet. They said
Yeah,
then-
it
Yeah,
says
it's
open abdominal
Oh
dressing.
yeah, yeah.
you're
abdominal
fine.
dressing. Yeah, that's true. Sorry.
Abdominal pad.
And then you
Alright.
pour your normal saline.
And
Into the
Or
curlex,
the
the
chest
large
bit.
roll.
to the Carlex.
Mhm.
Alright. You need two Q-tips, but you only have one. So we're gonna... Yeah man, let me look for one.
Open sterile applicators. What is that? Open. Did you see it?
Alright, so there's normal saline.
Mm-hmm.
And you put your
You put in the collect, yeah.
Carlex. It's supposed to be silica.
Mhm.
And then now I'm gonna do my
Your sterile
my
gloves.
sterile gloves.
Mm-hmm.
Alright, let me just put my thing here. Okay, don't move. Now my sterile gloves.
He likes it. He's smiling.
I hate the.
Now the sterile. Oh.
Now I can fix this. Alright, so now
So gently dry edge of wound with super sponge. One side, then the other.
alright, so and then the
You're
Sure.
assessing Rita.
okay, so I'm assessing Rita for redness, ecchymosis, edema, drainage,
Drainage.
and approximation. And then okay, so
Is
Third
eschar
time.
present or granulation?
yeah, eschar, granulation, if there's any maceration. Alright, the edge of the skin, nope. Alright, now I'm gonna check for my
Does it
tunneling.
appear beefy red, glistering?
Mhm. So now I'm gonna do my tunneling.
Mm-hmm.
Alright, I'm just guessing up to here.
How do you do that? Can you see it?
Alright, the tunneling.
Get closer.
Alright, so just to So tunneling and what's that word?
Undermining.
Undermining. So undermining is this. Okay.
Undermining is just a
And then
curve.
tunneling if there's a hole.
Mm.
All right.
Okay.
If there's
It's
a hole
tunnel, there's a
underneath
tunnel.
that thing.
Underneath the
So
skin.
that's tunneling. Okay.
Mhm.
All right. So let's say that's done. Let's say there's tunneling. You can either snap this or just remember it. But since I need
Is
to
that how you used to measure it?
the tunneling,
Mm-hmm.
yeah, you can snap.
Yeah, you
Snap
you
it.
just drop your measuring
You
measuring
drop it here.
equipment here, and then you can see the
Let's say
the
there's
Q-tip with
tunneling.
the measuring equipment which you drop in there after you measure the wound.
Then tunneling. Then how you document it? It's by the clock 12, 3, 6.
Clock direction.
Clock direction. So you snap it and then you just do it like that. But I'm gonna use this for my.
That's the second Q-tip.
That's the second Q-tips. So now I'm gonna grab my Carlex. If this is wet, it's supposed to be like that, right? If it's wet, it's gonna be like that, and then you do this. Then you add the Q-tips, and then you gently.
Pop. You pop the wound.
You what?
You pop.
Oh, you pack the wound. Yeah, you pack the
Yeah.
wound. Oh, that's not happening. Okay. And I heard of new information. You don't twist anymore. So you just pack it like that.
But when it's wet, it will stick there.
Yeah, but it's
It's
it will
sticking,
stick
yeah.
for sure.
It will not pop out.
All right. So you hold up,
Do you guys have markers? I can make copies for you, so I'll always leave.
and then you're gonna use the other super sponge. There's not supposed to be tape here.
Did you leave it out? Yeah. Thank you.
And then you put one sponge here. And you put the other one right here. All right. There's one thing that I missed. I forgot to prepare my tape.
Oh,
So
Yeah.
then put the abdominal pad here.
Call for help.
they ask assistant.
Actually, I don't need to be sterile anymore. I can just grab my tape. Right? I'm pretty much
Well,
done.
you can always send someone to get
But yeah, you
send
can
me
ask
instructor.
someone
Can you
else.
get my tape? I forgot. It's still sterile.
Yeah. You call for help. Hey, I need help. Can you grab my tape? You need 3. Oh, I think I did it too short.
That's too short.
Yeah. And then one for date and time. That's messed up. Hate this tape. For date and time. Let me redo this. This is too short.
Hmm.
Alright. So you put tape here. Actually, it's better if you start in the middle. So I messed that up. So there you go. And then one more.
Good job.
And then you put the date and time, your initial. And you put it just right here. Alright, Mr. Osena, we're done. Alright.
Good job.
Very good. Very good.
Good job.
And thank you. Alright, cover the patient. Take the trash.
Tell me about the measuring again. How you do
The undermining?
Yeah.
The undermining is just the very
Sure,
top.
you lower the bed. You prevent
It
fall.
doesn't have top. Undermining it's under, like it's